Child welfare. We cannot leave defenseless children anywhere exposed to ruin, moral or physical. We cannot run the risk that they will weep, starve, despair, or die with never a hand stretched out to help them. Child welfare is a continuum of services designed to ensure that children are safe and that families have the necessary support to successfully care for their children. Welfare agencies receive and investigate reports of child abuse or neglect, provide services to families that need assistance in the protection and care of their children, arrange for children to live with kin or with foster families when they are not safe at home, and arrange for reunification, adoption, or other permanent family connections for children leaving foster care. The mission of child welfare: to find a permanent home for children. This home is based upon the least restrictive environment and what is best for the child's needs. To help children who are placed in foster care, help is demonstrated through different services offered. To respond to reports made to child protection agencies, these can range but mostly fall into the following categories: abuse, physical, sexual, and emotional, exploitation, neglect, and misconduct. Child abuse is when a parent or caregiver refuses to act or by action harms a child, resulting in injury, death, emotional trauma, and many more. Adults and children come to report and seek child protective services, family support services, preservation services, and reunification services. Ethical dilemmas. An ethical dilemma is one in which a person has to choose between two options, both of which are morally correct but in conflict. Ethical dilemmas are when two or more professionally identified values are in conflict. For example, receiving gifts. Although seen as a kind gesture, they can prove problematic and can cross the line. When receiving a gift, if expensive, the worker can feel the pull to cross the line of integrity. Although rejecting can harm the clinical relationship between worker and client, when receiving gifts, if inexpensive and or homemade, it could be appropriate to accept if the relationship stays the same. Dual relationships. NASW strictly prohibits relationships outside of clinical, work-based environments. These are sometimes hard to avoid. Most social workers live in a community where they work, making not seeing their clients very difficult. It is up to them to decide the most ethical and appropriate way to interact with the client outside of the professional setting. Different personal views. Social workers may not always agree with the way their clients choose to live their life. Many differ in personal values, ethics, and thoughts on faith. As a professional career, it is important that they follow NASW, which forms guidelines for practices of the field. Caseworkers. In social work, a caseworker is a type of worker who is employed by a government agency, nonprofit organization, or another group to take on cases of individuals and provide them with advocacy information or other services. Child welfare caseworkers hire and supervise rank-and-file child welfare workers. They also arrange trainings, assign cases, assess performance, and offer advice or assist in difficult cases. Obstacles. The findings show that roughly 2 out of 3 workers say they have experienced obstacles. The main obstacle by far is related to time and/or large caseloads. This can cause the workload to become heavy and take away necessary time from clients in need of services. Not having enough time or too heavy of a workload can damage the quality of the work. Lack of organizational structure or poor management is a second major obstacle. Without organization or structure, the agency can become a mess. Poor management can damage the quality of services and damage the reputation of the agency. This ultimately can result in people from welcoming the agency's help. Collaborative problems with external partners and challenges related to providing evidence are another obstacle that is faced by welfare workers. In cases of abuse, although physical abuse is very noticeable, emotional is not. It is a long process to convict and get someone help for emotionally abusing their children or others. It takes a team to get everything figured out, and without the collaboration of the group members, they will never succeed. Advocacy. Here are some examples of ways to advocate and inform the public of the services available to them. Engage the public. Numbers say a lot to public officials. If you want a law change, then gain support through engaging those around you. Try the following sites to help rally others for a law change, or even to inform people of the services they can get a hold of. Know and use the facts. Make sure your statistics are up to date and that they are backed by real data. Knowing the facts is huge, but knowing how to use them is even bigger. Anything you say should be grounded by facts, and it is helpful to type it into a document that can be easily distributed. Handing out flyers is helpful if you can catch their attention, so using the facts as headers to reel in your audience is an effective way to capture their attention. Make sure you are heard. To successfully advocate, you should allow your voice to be heard. This can be accomplished through meetings with government officials, press conferences, letters, petitions, rallies, and phone calls. Don't forget that talking about it at dinner parties or social events can aid you in outreach. You never know who is listening. Never forget to say thank you to whoever took the time to listen to you. As future social workers, it is our job to advocate. Without it, the laws will never change and children all around us can stay in the same horrible situations. As I personally went through the Children and Youth program, I feel it is necessary to advocate so that those who don't have a voice can find one, to empower children to break the chain that can sometimes be caused by childhood abuse and do better than their parents. They will never know what can happen unless someone shows them, and it is our responsibility to educate and advocate. These are my sources.